These are the skeleton that you use to your fractured. First, you have to look like the skull like this. These are called the mandible. A mandible has to be strike of your disc. This is called the condyle. The condyle is just like this. These are now called as a condyle. A condyle skull has the thought for you to click. And this one for called temporal bone called fossa. Then you have the second called disc. Then you have the jaw, then you click on it. Then instead you have to click. Then the skull here like this condyle and fossa you want state, and you click on it for the hospital. Then you put here the disc and you click like that. Then the mandible, then you put your mandible on your teeth here like this. Then the skull, then you click like that one. Then the jaw they're called as a temporomandibular joint. And past they're called is for the way for use the condyle and called as the fossa. Then the fossa has the jaw for called as the empty sockets. Then the skull for use the record clicking like that one. Then click it. Then you swipe like on your jaw. Then using your disc, then you call like that. Then the disc, then you will put your condyle all over the socket. Then the jaw, then you open it there. Then for that way, you open, then you have to turn to lock. Then the lock, then you see it like the jaw for called lock jaw. The this was called TMJ disorder. Then you called the click. Then you have lock. Then lock here like this. Then click. Then click its jaw all over the world called the temporomandibular joint. They're called click. Then click. Then lock. Then you see that disc will become like that way it looks like. Then you fall down your socket. Then the fur muscles there come in. Then you click it, then your jaw, then you for use the temporomandibular joint disorder. Then the forward, then the jaw, then you clicking like this. Then you have to be jaw, then you get strong. Then the skull, then you look like the temporomandibular joint disorder. You have to go to hospital. Then the jaw, then you have to fix like this. Then it called like this, you're clicking its jaw. So that you have to click it like this, called as dislocation. Things are the dislocation as the jaw. Then you have to fix like this. Like this called dislocation. The dislocation of jaw, then you open it, then you have to fix like this if we call dislocation. Things are the jaw has called dislocation, as they mean the dislocation jaws. Then you have to be fractured, then you look like the dislocation of jaw. Then you fix it, then how to fix like this, called dislocation jaw. Things are the jaw, then you look like this one here called mandible joint. Then the skull called temporal joint, then you look like this. But sometimes even the skull is inside the neck. Things are the jaw there for you still on your front of the skull. Then the jaw, then you clicking that way. Things are that way you look like this, what you called the front of view. These are the temporomandibular joint disorder. Then you look like this one. Things are called the temporomandibular joints. Then you look like this one. As I mainly taught the temporomandibular joint disorder, then you click like this. So the temporomandibular joint disorder, then you click like this. These are the TMJ have to be no. Then the hospital, then the temporomandibular joint disorder. So that thing you look like to see undone. Then temporomandibular joint disorder. You have to see the mandibular joint all over to remove the disc are called the Condyle and Fossa. Things should look like the temporomandibular joint disorder. Then you have to click like this. Then you bite, they're called lock. This one called click. This one called click. This was called click the jaw. Then this one called lock. Then the one click. They were called click. Then you call dislocation. Then you open that one. Then you see a trauma. Then temporomandibular joint disorder called the broken called trauma. The trauma has to cut as the open this way. Malfusion. Then open the mouth. They're called the open bite. And instead for called as to call for empty sockets. The empty sockets are called the dislocation. The dislocation of called the jaw. You have to make it this one. The dislocation, they're called the jaw. As they meantime, the dislocation of jaw, then this could be broke all over the broke of the condyle. Then the condyle, they will see the jaw be locked. So that they look like lock of their jaw are called as dislocation. Things are the dislocation of jaw like this. They mainly type the dislocation jaw. They're mainly type. The dislocation jaw has to be crack of the condyle. The condyle has the jaw, and it has the release of their disc called the condyle and the fossa. Then the fossa, they mainly look like a jaw. Then the joints called the TMJ disorder called temporomandibular joint dislocation. Things are the dislocation, then you have to fix like this one. The jaw dislocation has to look like this. The dislocation jaw, for the way you sit for open, this one. Then the dislocation jaw, then you look like this one. Then the dislocation jaw, then you have to be ulcer and lots of their arthritic. The dislocation jaw has to be look like. Then dislocation jaw has to be seen to be undone. The dislocation jaw, then you be fixed like this one. Then you open its mouth for called dislocation of jaw. Then instead, the dislocation of jaw, then you look like this. Then you see the jaw has dislocation, then you be fixed like this one. Then how to fix but not there young. There the dislocation jaw has the skull. Then the skull has to be dislocated to your jaw. Then that one, dislocation jaws for that we look like that way. The dislocation jaw, then look like that way. Then how to fix one. How to fix that jaw, then can be unlocked. Then you look like jaw, how to fix. Then open its mouth, then you have to fix like this. Then if I use to fix like jaw, then all over the condyle. So that dislocation for condyle, then you fix like this jaw all over the world. Then the jaw will be fixed. Then the jaw has to be fixed like this. Then the jaw will fix, then dislocation, then you speak when you talk. Then the jaw will be here. Then you have to heal to your seconds all over the world. Namely, the jaw will be fixed, but do not yawn all over the second. Then you first the bandage, then you hear that thing, then you see the jaw, and then you cannot be yawn. Thanks for watching this video, and please for watching this video and share, like and subscribe button, click the notification bell. So check the comments below. Please don't forget to like, subscribe and click the notification bell. So thanks for watching.